Hi, my name is Megan Jean, and I'm an epidemiologist in the School of Human Evolution and Social Change at Arizona State University. This lecture is designed to give you a brief overview of the current Zika outbreak. Before we get started, I would like to remind you that Zika is a rapidly evolving situation, and the evidence is changing daily. Zika virus disease is an emerging viral disease that is transmitted primarily through the bite of an infected mosquito. Until very recently, Zika had been a relatively rare disease and a remote threat to humans. Today, Zika is spreading explosively in Central and South America, Central Africa, and parts of Asia, and it appears to be causing devastating congenital malformations and neurological complications. Zika has been a real surprise to those of us who study infectious diseases. No one expected this to turn rapidly into a global health emergency. Although it appears that this virus came out of nowhere, it's important to note that Zika is not a new virus. It was first identified in Uganda in 1947 in a rhesus monkey. One day in late April, a caged rhesus monkey on a tree platform on the shores of Lake Victoria in Uganda developed a fever. Within 2 weeks, researchers had isolated the virus that sickened the monkey. The illness, which had never been detected before, was dubbed the Zika virus after the forest where it was first found. Researchers soon discovered that the virus was mosquito-borne and that it could infect humans as well as monkeys. Over the next half-century, researchers identified the Zika virus in humans just 14 times, and it usually only caused a mild disease. About 10 years ago, the picture began to expand with the appearance of Zika outbreaks in the Pacific Islands. In April 2007, doctors on Yap, an island of less than 10,000 people in the western Pacific, saw an influx of patients with flu-like symptoms accompanied by rashes. The CDC determined that 73% of the population ages 3 and older had been infected with the Zika virus. The outbreak marked the first time Zika was observed infecting an entire population, and the first time it was noted in a place with no possible monkey carriers. Until the Yap outbreak, the disease was wrongly believed to mainly infect non-human primates and only occasionally infect people. Researchers have since learned that Zika can be carried by many mosquito species, including some that primarily bite monkeys and others that efficiently spread the disease among humans. In 2013, Zika spread throughout much of Polynesia, including Easter Island. In early 2015, doctors identified Zika as the cause of an outbreak in Brazil. And by the end of 2015, more than 1 million Brazilians had been infected, making it ground zero for the largest outbreak in the Americas. By September 2016, 48 countries and territories in the Americas and 10 countries in the Pacific Islands, Asia, and Africa had reported active Zika transmission, meaning that mosquito populations in those places were spreading the disease. In the mainland U.S., the disease has taken hold in parts of Florida, and hundreds of travel-associated cases have been identified elsewhere in the country. Zika has quickly become an increasingly serious health and environmental concern. There are two main reasons for the virus's rapid spread. First, the population in the Americas had not previously been exposed to Zika and therefore lacks immunity. And second, the Aedes aegypti mosquitoes, the main vector for Zika transmission, are present in all of the region's countries except Canada and the continental Chile. Until recently, most researchers didn't think that Zika was that dangerous. Most people who became infected with Zika, they don't even know that they have it because they don't get sick. These are people infected with Zika that are healthy and asymptomatic. But about 1 in 5 do get sick, but the symptoms are mild. And if you're sick, the symptoms are typically pretty mild. So fever, you can get skin rashes, conjunctivitis or red eyes, muscle and joint pain. And these symptoms typically go away within a week. The incubation period for Zika is about 3 to 14 days from latest evidence. And the incubation period is the time from when you're exposed to the time when your symptoms show up. And currently there is no licensed treatment or vaccine for Zika. So I've just told you that the majority of people who get infected with Zika don't get sick. And if they do get sick, their illness is typically very mild. So why are public health officials all around the world so worried? Well, the answer is that most of the concern is focused on women who become infected while pregnant, as well as those who develop a temporary form of paralysis after exposure to the Zika virus. Scientists have recently determined that Zika causes microcephaly, a birth defect where baby is born with a small head. And because the head is small, the brain is small too, meaning it's underdeveloped, and this can cause a whole range of other health issues, like cognitive deficits, seizures, feeding problems, vision problems, hearing problems, and even death. Microcephaly is typically seen in about 1 per 10,000 births in Brazil, according to the Journal of Birth Defect Research. And this translates to several hundred cases, approximately 150 expected cases of microcephaly each year. But in 2015, officials documented more than 4,000 cases, and that's 20 times the usual number. It's important to note that these are suspected cases, not confirmed, and case reports usually increase when people are alerted to a potential health crisis. But still, 20 times the usual rate is a huge increase and a concerning increase. So some of the key epidemiological evidence in support of a causal link between Zika infection and microcephaly includes temporality, where microcephaly cases in Brazil started to rise around 6 months after authorities confirmed Zika transmission there, hinting that the defect might have been caused by exposure to virus in the womb. Second, biological plausibility. If Zika causes microcephaly, then it most likely enters the placenta and damages the growing brain of the fetus. And in fact, CDC has reported that Zika virus has been found in the brains of 2 babies with microcephaly who died within 24 hours of being born, and it has been found in amniotic fluid and placental tissue from miscarriages of women who've been exposed to Zika virus. And just days ago, researchers sequenced the Zika genome, providing the most compelling evidence to date that congenital brain malformations associated with the Zika virus infection in pregnancy are a consequence of viral replication in the fetal brain. We also have evidence from mouse models experimentally injected with Zika. Normally the cells are organized and neat, like on the left picture here. But during Zika infection, the cells become disorganized, blood vessels expand, and holes in the tissue appear during viral infection. Although all available evidence supports a link between the infection and poor pregnancy outcomes, we don't yet know how often these infections cross the placenta and how often Zika infection results in brain malformations. So in addition to microcephaly, researchers are closely watching instances of Guillain-Barré syndrome. In countries with circulating Zika virus. During the Zika outbreak in French Polynesia a few years ago, doctors saw a 20-fold increase in Guillain-Barré syndrome. This is an autoimmune disease often triggered by infections in which the immune system attacks the myelin lining of nerve cells, resulting in widespread weakness and paralysis. In countries where Zika is spreading, including Brazil, El Salvador, Venezuela, they've also seen similar spikes in Guillain-Barré symptoms. So, Just to sum up, we've got a virus that appears to infect brain tissue and outbreaks that correlate with two very serious types of brain damage. There are 4 known ways that Zika virus can be transmitted. The majority of Zika transmission is through the bite of an infected Aedes species mosquito, Aedes aegypti and Aedes albopictus. These are the same mosquitoes that spread dengue and chikungunya viruses. Mosquitoes become infected when they feed on a person already infected with the virus, and then infected mosquitoes can spread the virus to other people through bites. As we've already talked about, the second mode of transmission is from mother to child. A pregnant woman can pass Zika virus to her fetus during pregnancy or around the time of birth. To date, there are no reports of infants getting Zika virus through breastfeeding, so mothers are encouraged to breastfeed even in areas where Zika virus is found. Third mode of transmission is through sex from a person who has Zika to his or her partners. It's important to note that Zika can be transmitted through sex even if the partner does not have any signs or symptoms of disease. We also know that Zika can remain in semen longer than other bodily fluids. According to CDC, Zika may be present in semen for up to 10 weeks after the onset of illness, but it's unknown if the virus can persist in semen for longer than that. The last mode of transmission is through blood transfusion. There have not been any confirmed blood transfusion transmission cases in the U.S., but there have been multiple reports of blood transfusion transmission cases in Brazil. These reports are currently being investigated. So how are governments and public health professionals responding to Zika around the world? Well, on January 22nd, 2016, CDC activated its Emergency Operations Center to respond to outbreaks of Zika occurring in the Americas and increased reports of birth defects and Guillain-Barré syndrome in areas affected by Zika. The EOC brings together scientists from across CDC to analyze, validate, and efficiently exchange information during a public health emergency and to connect with emergency response partners. On February 1st, 2016, the World Health Organization declared Zika to be a public health emergency of international concern because of clusters of microcephaly and other neurological disorders in some areas affected by Zika. The WHO emergency declaration allows for a coordinated global effort to get underway, enabling surveillance for microcephaly to be standardized and research to be intensified. And then on February 8th, 2016, CDC elevated its EOC activation to a level 1, the highest level of response, which is reserved for critical emergencies. The U.S. has also allocated more research funding to Zika. The CDC has issued a travel advisory urging women who are pregnant or thinking of becoming pregnant to avoid traveling to places where Zika is actively spreading. If travel is necessary, health officials recommend taking extra precautions to avoid mosquito bites, including wearing long-sleeve shirts and long pants, staying indoors with air conditioning or protective screens, and using insect repellents. Health officials in Brazil, the epicenter of the outbreak, issued a warning to pregnant women about the possible links between Zika and microcephaly and have been aggressively spraying for mosquitoes. Some governments in Latin America have issued even stronger messaging, advising women to avoid having children for the next 2 years. Health officials have also asked people to remove breeding grounds for mosquitoes in and around their homes and to avoid being outside at dusk and dawn when the bugs tend to feed. A lot of students want to know the risk of Zika transmission in the U.S. Although mosquitoes that can transmit Zika virus are present in Arizona and in many other parts of the country, we've only seen local transmission in Miami so far. Most experts believe that although some local transmission is inevitable, most outbreaks in the U.S. will be quite small with a dozen or so cases. A new epidemiological modeling paper by Andrew Monahan, climate scientists at the National Center for Atmospheric Research in Boulder, Colorado, uses data on climate, mosquito breeding patterns, poverty, and air travel to identify the U.S. cities at the greatest risk. As you can see in the figure, the southeast part of the country faces the highest risk, the eastern seaboard faces a moderate risk, and the western U.S. has a lower risk. The areas with the highest risk of Zika transmission are in South Texas and Florida, particularly places like Miami, which has both the right climate for the mosquitoes to breed and an influx of travelers from Zika-infected areas. We have a couple of things going for us in the U.S. to minimize Zika transmission. Zika is primarily transmitted through the Aedes mosquitoes, the same insects that spread the dengue and chikungunya viruses, and neither of these two viruses have had lasting transmission in the U.S. Second, we have good mosquito control and air conditioning, which minimizes exposure. Third, we have a very strong local public health system, and including surveillance systems. The Zika outbreak is really what we would call a perfect storm of biological events. The introduction of Asian and African mosquitoes, the spread of yellow fever and then dengue, followed by chikungunya and now Zika, the El Niño climate event, and a Brazilian crisis in both economics and politics. Any one of these events would have been manageable, but combined, the events have fueled an explosive spread of Zika virus. Zika is still spreading explosively, and it is causing devastating health effects, and the level of concern remains high. Many public health experts feel that Zika poses a greater threat than the Ebola outbreak of 2014 and 2015, which killed 11,000 people. Zika is a silent infection in a group of highly vulnerable individuals, pregnant women, that's associated with a horrible outcome for their babies. And right now we have far more questions than we do answers, and far more research into Zika virus is urgently needed. And although I've approached this lecture from an epidemiological perspective, I highly encourage you to consider the Zika outbreak from the many other academic perspectives that we cover in this course. Prevention and treatment for Zika, like many other complex health problems, is multidimensional and linked to our social, cultural, religious, political, environmental, and economic systems. The alarming spread of Zika is as much about the extreme inequality and underfunded public health services and the powerlessness faced by women in Latin America as it is about health. Thank you.